Hi friends, I hope you all have revised the different gram-negative organisms up till now, be it the Enterobacteriaceae family, the Vibrio, the non-fermenters, because now we move ahead with our journey and talk about HBB. These are three short organisms, Hemophilous, Bordetrll, Brucella. We'll try to keep it short yet effective so that we can solve all the questions. Starting first with Hemophilous, and I've highlighted a few alphabets out here because the most important point about it is that it is oxidase positive. In fact, let me tell you that this entire HBB family is only oxidase positive, and that means we have come to that phase of our preparation where catalase positivity mnemonic space being made is done, urease positive punch kiss is done, oxidase positive is left. So what are all the oxidase positive? And I'm very sorry that I'm giving you a repetition of a mnemonic, but we don't have an option. For urease positive organisms, we had something called punch kiss, right? And I'm just going to alter that punch into PVNCH, almost like a punch, and that is going to be oxidase positive. So what all do we have in it? We have P for Pseudomonas. Right now we had only studied it utilizes sugars oxidatively. So yes, the previous chapter we have done this, oxidase. Even for Vibrio we had done it as oxidase. Remember, it was also a part of the coins mnemonic. It is oxidase positive. Then Neisseria, go back to the cocci. We made a table. Meningitis, gonorrhea, oxidase positive, purple color test. We've done it. Then the two bacters, Campylobacter, Helicobacter, and with H you will also do this entire HBB family, Hemophilous, Bordetrll, Brucella. So repeating, Pseudomonas, Vibrio, Neisseria, Bacter, Campylobacter, Helicobacter, and HBB. All of these are oxidase positive. So yes, that is it about. It's a gram-negative organism, oxidase positive. Rest nothing is fancy about it. Non-motile, non-sporing. So coming to the virulence factors. Now before that, which Hemophilous am I first and foremost going to talk about? Hemophilous influenzae, which has a lot of F's in it, and that is Pfeiffer's bacillus. That will also remind me later on that because I'm saying Hemophilous influenzae, which is FF, Pfeiffer's bacillus, it requires two factors, that is factor X and factor V. That is also going to be important. So factor X and factor V are going to be there. Now before that, I want to tell you that Hemophilous influenza has a capsular polysaccharide. Now whenever you have capsular polysaccharide, means it's antigenic, means you can divide it into many subtypes, and there are 6 subtypes that are known starting from A to F, out of which you will always come across H1B, because H1B is the one that is the most virulent. H1B is the one on the basis of which you will make a vaccine. So that part of it I want to address over here, that when you're making a vaccine, that vaccine is known as H1B PRP. I'll tell you the vaccine in 5 minutes. PRP is basically a situation which will enhance your immune response, your IgG, your IgA, your IgM. That is why you're using it in vaccination, something that should increase your immunity. So what is this PRP if you want to know the full form? It stands for polyribosyl ribitol phosphate. Do you want to know the full form? I don't think so. So polyribosyl ribitol phosphate is what is going to be the one that you've added so that you can have immune response, and that is why it's used in vaccines. So overall, you just had to know that this has a capsule. It's H1B out of the 6 serotype, Hemophilous influenzae type B. That is the virulent, that is the vaccine, name of vaccine, H1B PRP. Other than that, this also has outer membrane proteins and lipo-oligosaccharides because it's a gram-negative organism. Now, I just told you that it has a capsule, but that doesn't mean that every Hemophilous influenza is going to have a capsule. Please note that there are 2 types of Hemophilous influenzae, and that says that if you're saying they're invasive, then in those cases the capsule will be there. If you're saying they're non-invasive, this means the capsule is not there. So that's why capsule is a virulence marker. If it's there, the disease is invasive. If it's not there, the disease is not invasive. So right now I told you on the basis of the capsule, which was the type that was the most commonly causing one, it was H1B, whereas if there is no capsule, then there is not going to be any kind of typing that is possible. Further, if you ask me, you're saying it is invasive. Where is it going to invade? You'll say, ma'am, 2 places. First, it's going to invade to all weird, major organs of my body, like it's going to go into the brain. It can cause, things like meningitis, pneumonia, sepsis. It will invade a lot. And second, it will also invade into my blood. And anything that will invade into my blood, this means that is going to come out in a blood culture positive. So the entire story I gave you now, you don't have to learn it like a table that you always do, because I've seen many people learn this like a table. Okay, this is present absent. No, just put a little bit of logic into it and you will know that, for example, you have over here something which is invasive. So invasive wala is invasive because it has a capsule. Anything that has a capsule will have many types. That is why H1B is the type here. Anything that is invasive will invade to all the major organs of the body. It will also invade to the blood of the body, and if it has gone into the blood, you will see it in the culture as well. The only thing that you have to know is Hemophilus influenza. This usually involves the children. Now make everything opposite. If it is non-invasive, means it doesn't have the capsule. It will occur in adults. It is not going to go into the blood. It's non-invasive, only locally. It will cause local things like maybe some kind of ENT infections, maybe some kind of otitis infection, some sinusitis, maybe some COPD exacerbation. It's not going into brain and major organs. It's only going to go locally. So this means it's not going to come in the blood culture. And there are no types, no capsule, no types. How easy does that become? So what are the clinical features that I've already explained to you? I've told you it causes meningitis, it can cause pneumonia, it can cause LTB, laryngotracheobronchitis, which is also known as croup, and it can cause suppurative lesions also. Very well. Yes, now we need to know how am I going to take the specimen. So imagine you have a patient of meningitis. You'll take a CSF sample, or you have a case of pneumonia, you'll take a sputum sample. So your sample is going to vary depending on whether blood hai, CSF hai, sputum hai. But what is the precaution is that Hemophilus influenzae is very, very scared of cold. Please do not refrigerate this sample ever. That is why we don't prefer refrigerating a CSF sample, because if it is meningitis caused by H. influenzae, it's not going to show up if you refrigerate it. So till now you had learned a lot of things like yersiniosis and listeriosis, and there I told you that you should do cold enrichment. If you grow it at 4 degrees, better hoga. But Hemophilus influenza is not grown and not to be done over there. What is the microscopy? It's a gram-negative cocobacilli. There's no doubt about it. So what are you going to do next? Now I told you it's a Pfeiffer's bacillus. If I'm calling it Pfeiffer's bacillus, it requires something known as factor. That is why we said hemo, I'm going to write everything with F now. Hemophilus influenza. So Philus influenza fever requires X and factor V. I'm calling it factor X and V, but most people call it 10 and 5. That helps me learn one thing, that the way you say 10, it reminds you of the other name, that is hemin. So the 10 wala is hemin and the 5 wala is NADP or NAD, right? So remember 10 is hemin and 5 wala is NAD. So you say that if Hemophilus has to grow, it needs factor 5 and factor 10, which a simple blood agar cannot give it. These factors, some of them are there, some of them are hiding inside the red blood cells. So you will have to break the red blood cells, then only these factors are going to come out. So please note, you take a blood agar, and what do? You put a streak of something known as Staphylococcus aureus. If you go back to your first chapter of bacteriology, I've told you, Staphylococcus aureus shows you a narrow zone of hemolysis. There is a narrow zone of hemolysis noted, means narrowly, just area around it, it's going to break the blood. If it will break the blood, those factors will come out. This means Hemophilus will have a party. Hemophilus will say, oh, you mean to say in this much area, narrow zone, the factors are available, factor 5 and 10 or X and V are available. Oh, this means Hemophilus will start growing over here. Can you see these ... Hemophilus has started growing over here. So can I say if this is a Staph aureus, the Hemophilus has basically become like a satellite. If this is the Staph aureus, Hemophilus is growing like a satellite around it. So this process is known as satellitism. Satellitism because of which factors that it is getting provided? Factor 5 and 10, or you can say V and X. Okay. So this was about satellitism, Hemophilus influenza, very, very important test. Now coming to the culture you've done, now you come to the treatment. So of course in the treatment you're going to give antibiotics, you can give ceftriaxone, cefotaxime, right? But the precaution that you have to take is you have to get yourself vaccinated, and you know the vaccine H1B, PRP, I told you na, it will help in immunogenicity. So that is done. Hemophilus influenzae is done. 2 Hemophilus are left. Hemophilus aegypticus, and I'm calling it aegypticus for a reason, because Hemophilus aegypticus is known as Koch, not Koch. So Koch hoga mamu, Koch's bacillus is TB, so not Koch. Koch weak bacillus. It is known as Koch weak. So that is why I'm calling it Hemophilus aegypticus. Sirf Koch hota, you would have called it Koch's bacillus is TB. I'm saying Koch weak bacillus, so that is Hemophilus aegypticus, and it causes something to do with little pink. P and purpura. It causes pink eyes with Brazilian purpuric fever. So this is basically a kind of a conjunctivitis. Pink eyes matlab conjunctivitis. So it causes pink purpuric fever. Pink eyes, purpuric fever. That is what this Egypticus scotch weak bacillus is gonna cause. It's a kind of a conjunctivitis. Next one we come to is Hemophilus ducreyi. Ducreyi is gonna cause chancroid. Ducreyi is gonna cause chancroid. That is a soft sore. You need to find out whether it is painful or painless. So please note, ducreyi has the word crying in it. Someone is crying with pain. So this genital ulcer is a painful genital ulcer. Please note, you very commonly confuse it with syphilis because syphilis shows you a chancre. Syphilis shows you a chancre which is very, very hard, but the problem is that syphilis mein yaad rakho syphilis. Syphilis wala is gonna be painless, whereas Hemophilus ducreyi is gonna be crying with pain. So this is gonna be painful. So always remember, crying with pain, and ducreyi chancroid, crying with pain. Okay, so what is the culture media? Can you grow it on a regular culture media? No. So ducreyi says, I am crying with pain. You just give me one little bit of chocolate and I'm not going to be happy. You will have to give me some extra energy. I have cried so much. So if you try to grow it in a simple chocolate agar, nahi hone wala. You will have to supplement it with some vitamins. Now, if someone has cried, you feel very exhausted after you cried. Now, medicals to know we cry before and after every exam. So once you cry, you feel very, very drained out emotionally, physically, right? So you don't need chocolates, you need some vitamins. So to grow Hemophilus ducreyi, because of the crying, it needs isovitalix, which is a kind of a growth factor thing containing in the chocolate agar. Now you do a tissue biopsy and staining. You see the very, very famous bipolar staining. Bipolar staining means, again, I have taught you earlier, this is the safety pin appearance that you see, and they are all present like this. Can you see a school of fish? School of fish appearance. I want all of you to make a quick table over here. School of fish appearance is in front of you, but where do you see the fish in stream appearance? Fish in stream appearance was seen in Vibrio cholera, and now of course this confusion will definitely occur. So if you remember, Vibrio cholera had a rice water stool. Kaisa stool tha? It was foul smelling, fishy bad odor, flaky mucus, fatafat matlab sudden onset, and fish in stream. That is how we had learnt it, that Vibrio cholera is flaky stools which are fishy odor, which are fatafat, sudden onset, and fish in stream appearance, whereas school of fish appearance is seen in Hemophilus ducreyi. Finally, how do you do the treatment over here? So please note that the treatment is done by azithromycin. Okay, so the take home message out of this entire thing were two. What kind of an ulcer is it? Painful, painless. So crying with pain, painful. Second, can you grow it on a regular chocolate agar? No, you need some vitamins, isovitalix. And where do you see the fish in stream? So fish in stream, Vibrio cholera. Now, before I end Hemophilus, there is something known as this. What is this? Bhai, das and hum panch. What? I've taken you into such a famous meme, Bhai, then I've taken into, there was a movie called Das, then hum panch was our favorite childhood serial. So then what is this? Why suddenly? Because there is a table that you have in Hemophilus chapter which no one ever reads. Today I will make you read, and after this will, I promise, your favorite table is gonna be this. I can assure you that. So I'll tell you how. I can see a lot of Hemophilus written. Jaldi se ek baar naam pad lo, and after that I will tell you what you need to know. Which are the ones which are gonna show you hemolysis? Common sense. Search for the one which have hemolyticus in the name, because only those show you hemolysis. One table is done. Hemophilus, hemolyticus, parahemolyticus. Which are the ones that require CO2? CO2 का मतलब afro. So afrophilus requires CO2 and paraphrophilus requires CO2. So afro का मतलब होता है that they require CO2. That is also done. Now we will say which of them require factor 10 and 5. That's why I call them 10 and 5. I don't call them X and V, because 10 and 5 will give me mnemonics. So which are the ones which only require factor 10? Only 10. So 10 will remind me of only thus. Thus means ducreyi. Thus is gonna be ducreyi. Which are the ones which require only 5? Panch, hum panch. So panch means all para things. Para-influenza, para-hemolyticus, paraphrophilus. वहाँ जहाँ para आएगा, you will say, oh, panch. They need factor 5. Where ducreyi thus will come, that needs factor 10. And whatever is left requires both factor 5 and factor 10. So bhai bhai dono dono, 5 and 10 dono dono. Bhai bhai basically tells me, now I'll tell you that bhai bhai means both, means Hemophilous, H, A and I. Search for them. Hemophilous, H, matlab search for it. Hemolyticus requires both. HA, Hemophilous aegypticus requires both. Hemophilous influenza requires both. So can you all now figure out this table? Hemolyticus that you had, then you had aegypticus, and then you had Hemophilous influenzae. Simple, guys. So bhai bhai ho gaya. Bhai bhai means both the bhai bhai factors are needed. Hemolyticus, aegypticus and influenzae. Now tell me, what do you think Ducree will need? Ducree will only need thus. What do you think the para-influenza will need? Para-hemolyticus will need? Para-frophilus will need? Ma'am, all these para things are only gonna need factor 5. I told you it's gonna be your favorite table. Repeat. So the hemolyticus, quick revision of this entire table. The hemolyticus is gonna be seen only by the hemolyticus and the parahemolyticus. CO2 usage is only needed by aphrophilus and parafrophilus. Then Ducree is only gonna need thus. All the para, the parahemolyticus, parainfluenzae, parafrophilus, they only need 5, whereas bhai, this means both are needed by hemolyticus, by aegypticus and by influenzae. Table is done. Now we can come down to the next part, that along with this Hemophilous, we have something called a Hackett group. What is this Hackett group? Because this is famous, very famous, especially guys in endocarditis. You must have seen in your modified Duke's criteria for infective endocarditis. They can also call respiratory infections and UTI. So Hackett is Hemophilous aggregatibacter. There is Cardiobacterium, Eikenella and Kingella. So there are these different organisms that you have. Again repeating, Hemophilous, Aggregatobacter, Cardiobacterium, whose name keeps on changing all the time, Eikenella and Kingella. These are responsible for causing infective endocarditis. Because Hemophilous comes here, they're also normal mouth commensals, and because Hemophilous comes here, I've got you over here. Hemophilous done. The next one that we go on. Remember, we were doing HBB organisms. Hemophilous is done. Now let's go on to Bordetrll. Bordetrll has nothing very special. No motility, no sporing. But Bordetrll ki body hai. Bordetrll has a body. Body means it has a capsule. Right? It has a capsule. It has a body. And body is never gonna come in one day. You will have to work for many months. It's a 100-day cough known as whooping cough, and pertussis is the same thing. So remember, Bordetrll ki body hai. That is, it has a capsule that has come after many days of hard work and panting out of breath by running and gymming. So whooping cough, 100-day cough with a capsule. That is the story of body wala Bordetrll for you guys. So first I'm going to tell you the question which no one likes, virulence factors, right? So virulence factors mein I'm going to tell you, if you can learn it, very good. Even if you can't, learn some basic words, because right now no one's going to ask you the virulence factors, but I will club all these virulence factors and I'm going to make a vaccine in the end. So we have agglutinogens. We have FHA, that is filamentous hemagglutinin, and we have pertactin. I'm going to tell you a vaccine in the end. Repeating, agglutinogens, which will help in attachment. Filamentous hemagglutinin, that is also helping in attachment, and that is exactly what I'm telling you I will use in the vaccine. And pertactin is also a virulence factor. Apart from that, of course, you can never ever omit the toxins. Come on guys, toxin to you know, Bordetrll pertussis ka toxin, I have already told you. Pertussis toxin is said to be one toxin, but actually it is having a lot of factors. If you look at their names, we have LPF, HCF and IAP. So LPF, you don't have to know their full forms, but you need to know that one main word. So when we say lymphocytosis producing factor, you should be knowing that these are the organisms, or these are the infections which cause lymphocytosis for us. Second, they are histamine sensitizing factors. They are going to sensitize histamine. And thirdly, they are islet activating proteins. If their islet activation is going to be caused, that islet activation basically means that the patient is going to secrete a lot of insulin. Insulin means that the patient is going to enter into hypoglycemia. So repeating, pertussis toxin actually has many properties. It's going to cause lymphocytosis. It is going to release histamine. It is also going to activate islets and causing hypoglycemia. But what exactly is the pertussis toxin? I hope you remember, pertussis toxin, like any other toxin, is A and B. That is not a problem. It is going to have a fragment A and it is going to have a fragment B. But do you remember, it increases adenylate it cyclase. Quick review, cyclic AMP वाले कौन कौन से organisms थे guys? For cyclic AMP I told you M को थोड़ा सा ऐसे split कर देना, just turn it around. So after you turn it around, it's gonna become an E like this. Earlier it was like this, I made it into this, that is E. So first and foremost, I told you cholera is gonna increase cyclic AMP, anthrax is gonna increase cyclic AMP, E. coli ka labile toxin, labile in the air, and now we finish the P, that is pertussis. All of them increase the cyclic AMP. Then of course there are other things like heat labile toxin, the tracheal toxin, that is why whooping cough hai, so everything has to be with respiration, and there's a lipopolysaccharide. What are going to be the clinical features? Of course, you know that this is going to be a long phase. This is said to be a 100-day cough, and the incubation period is said to be somewhere between 1 to 2 weeks. So let me tell you what exactly is this cough. How does it come? So starting mein everyone doesn't come up with whooping cough. Starting mein it is just some very catarrhal features. So first catarrhal features mean there will be little bit of dry cough, little bit of fever, like little infections, little symptoms. But the patient is maximally infective at this point of time. So remember guys, there is gonna be little fever, little cough, but the patient is gonna have maximum infectivity. This is the time you have to stay away from the person, catarrhal. Now the next stage, paroxysmal, that is when the patient will have that whoop. What is that whoop? Whoop is something which you call as bouts of cough. He will suddenly intake a lot of air, gasping of a lot of air, that is whoop will happen. And so much of coughing will happen that there is also going to be post-tussive vomiting. There is also post-tussing vomiting, means he will cough so much that he will end up vomiting. That's a classical history you get for a Bordetrll pertussis infection. And finally comes the convalescent, where the recovery, so the patient is going to go into less severity. So repeating, initially is all starting stages, but patient is very infective here. Then comes paroxysmal, that is the real cough, and then comes convalescent. Some people also describe this as the bark of a dog kind of a cough. Now let's come to the clinical features. What are the complications that will arise? So much the person is coughing. Imagine coughing means so much pressure on the hemorrhage, on the brain, so on the eyes. So can I say because of this there can be subconjunctival hemorrhage because with so much of pressure he is coughing. So number one, pressure problems. Second, as I told you, there are going to be respiratory problems because it's affecting the lungs. So lung collapse can occur. And finally, this can also affect the brain, and that is known as the convulsions and coma. So these are the different ones, but pressure effects is what they will ask you. How do you think you're going to do the diagnosis? First, you'll have to take a sample. The only thing is patient is coughing. So either you can take something from the oral cavity, or you can take something from the nasopharynx, or you can make him cough onto something so that the droplets are secreted. So basically, you can either take, the best one is a nasopharyngeal swab like you were doing for COVID. But other than that, you can take one from the anterior part, that is per nasal. You can also take from per oral. And if you can't take any of these samples, just keep a plate. For example, you keep a plate like this in front of the patient. You know, the agar plate is kept like this, and you tell him please cough onto this. So all the secretions will go and deposit, and there will be growth that will be seen. Okay? So remember, that is known as the cuff plate method. So these are different methods, either from the nasopharynx or per nasal or per oral, or tell him to cough and that growth will come over here, cuff plate method. Please note that we have to take a total of 6 swabs are taken total, all these places, and they are transported usually in the casamino acid solution. Also note that we don't use cotton swabs. Usually we use cotton swabs, but for Bordetrll pertussis, we don't use cotton swabs. Dacron is one preferred element, and calcium alginate can also be used, but cotton nahi use karna. That is what is important. Cotton ke saath the growth is not gonna come. So whatever method you took, the swab or the cuff plate, what plate are you talking about? So simple. When I'm talking about the Bordetrll, the culture is gonna be Bordet Gengu. Other than that, there is Regan Loei, there is chocolate agar also, but Bordet Gengu for Bordetrll is sounding like the most logical thing to learn for me. And I can see that there are some dome-shaped colonies called mercury drop appearance. Mercury drop, or you can call them bisected pearls. So Bordetrll pertussis shows you bisected pearls. Bahut simple hai. Write it with me. When you write Bordetrll pertussis, firstly you should know from this name iska body hai. Body matlab iska capsule hai, right? Then you should know that body banane ke liye you need time. This is gonna take 100 days. This is 100-day cough. Next, you should be knowing from the word Bordetrll, the name of the Culture is Bordetrll culture media. And from the word Bordetrll pertussis, you are gonna get bisected pearls. That is what you get, bisected pearls appearance. Maximally in bacteriology, I have tried that your mnemonic should come from the name itself. Okay, so bisected pearls is Bordetrll pertussis, Bordetrll medium. Have you imprinted this into your brain? Thumbprint bana lo, Bordetrll pertussis, because you have to make a thumbprint. You see these? ऐसा thumbprint kind of architecture. So that's the next thing that you see out here. So please remember, Bordetrll pertussis shows you bisected pearls appearance, and it is also going to show you finally the printing. It is also going to show you the thumbprint appearance. In fact, if you tell me that over a few weeks, because 100 days chala na, so ma'am, can you tell me over a few weeks, how is the diagnostic modality going to change? So remember, all this Bordetrll medium and all is the best, I agree, the culture medium and all, but it's only in the starting part. It is only in the starting part. Can it also come many months later? Yes, it can. And in fact, please note, starting mein to it's looking like these bisected pearls, they are alag. If you allow them to grow a little more, you know what they'll look? They'll all become confluent. And if they will become confluent, they will result in an aluminium paint appearance. They will result in an aluminium paint appearance. So remember, culture is very important in the first 2 to 3 weeks. PCR is also good, but in the later stages, PCR is somewhere gonna fade away, and serology is also there after that, but serology also in the later cases, the antibody levels can go down. So the culture, PCR and serology is what is gonna help you. So what is the treatment and the precaution? The treatment mein drug of choice is azithromycin. Please remember, even the close contacts are treated like patients. Consider the close contacts also like patients, and you have to give them, irrespective of whether they are vaccinated or not vaccinated, you have to give them macrolides. You have to give them macrolides, whether they are vaccinated or unvaccinated, irrespective of that, they are treated like patients. Now, tell me, which vaccine do we have? So, pehle, remember we used to use DPT. So, the pertussis vaccine, diphtheria, pertussis, tetanus. So, the pertussis vaccine that we were using was a whole cell vaccine. Problem with whole cell came was patients started having encephalopathy. So, they said ke nahi, whole cell to nahi, cell component hatao, remove the cell. I need something known as an acellular vaccine. So what is this acellular vaccine that you have to know? Please note, I told you some factors in the beginning and I said, Abhi, just go through them. You will have to learn them. Did I tell you there was filamentous hemagglutinin, then there were agglutinogens, there was pertactin, and there was pertussis toxin. Remember this? I told you just learn it, because these are the factors, but no cell. These are the factors that I've used. So I can say these are the 4 things that have made my vaccine. The agglutinogens, the filamentous hemagglutinin, the pertussis toxin, and the pertactin. These are the ones that have made my vaccine, and here they don't have a complication. So now you must have seen that instead of writing it as DPT, we write it as DTaP. What is AP? Acellular pertussis is used, because now you don't use whole cell vaccine, you use the acellular vaccine, and that definitely wraps up our discussion of the Bordetrll also. So we were on our journey of HBB. Hemophilous is done, Bordetrll is done, and now we are left with Brucella. Brucella happens to be a zoonotic infection, which means it's an animal to human kind of a disease. And there's a nomen classification that you have, which I understand is very difficult, and you don't have to learn the entire one. So just imagine that this is all to do with animals. And we all know that when you are coming in contact with animals, you have to put on a mask. Your protection and mask needs to be on point. So what is mask? M for melitensis, A for abortus, S for sui, C for canis, ovis, nutame, mask on. Repeating, we have the famous melitensis, abortus, suis, canis, ovis, nutame, mask on. Do I have to learn the animals of all? No, some of them are common sense. Suis always means pig, canis always means dog. Now I just need to learn the most pathogenic one, and that is melitensis. Melitensis is the one that is associated with sheep and goat, and that is the most pathogenic out of these. So what exactly are the antigens? Very simple again. As I said, mask on mein M for melitensis, that has the M antigen. The next was A for abortus, that has the A antigens. All gram-negative organisms have a lipopolysaccharide, so that goes hand in hand. But something that helps in binding, you must have seen many of the books have given you a very detailed way of it. I don't want you to get into it unnecessarily confusing yourself. So for binding, these have two molecules called BVRR and BURS. BVRR and BURS are two, special chemicals that God has given it for binding, and that's it. So remember, M antigen for melitensis, A for abortus, and BVRR and BURS. Finally, what is this zoonotic disease? Zoonotic disease means it's coming from animals. Either it can come from direct contact or it can come from some milk product. So those are of course going to be the ways by which an animal can come in contact with us. Direct contact is obviously the most common. So in humans, this tends to go in the reticuloendothelial cells. Anything that will go in the reticuloendothelial cells will always cause reticuloendothelial cells is what? It's a very, very big name for something very simple. That is macrophage. It's always going to cause hepatosplenomegaly. The incubation period of this is roughly 1 month. So you can say 1 week to 1 month or 10 days to 30 days. And these patients are going to have very non-specific things. There are things like night sweats and there is joint pain, hepatosplenomegaly. Yes, actually, if I show you a full description of what all does this patient have, he can have an entire organ involvement. So there are multiple stages. First of it is going to be a latent stage. Latent stage just means that clinically patient has latency, nothing, only the serology, and I'll tell you the serology, only the serology is coming positive. Then the person enters into acute and chronic, in which acute is the one in which all the symptoms will be seen. I just told you a triad of fever and night sweats. Then there is joint pain, right? Fever, night sweats, joint pain, and hepatosplenomegaly is there. All that we have done. But apart from that, if you do blood test, these patients also show you bleeding because there is a low platelet count. So please note, there is night sweats, there is arthritis, there is hepatosplenomegaly, plus there is a decrease in the platelet count also that you notice. Also, you must have seen that this is very dangerous just in case someone is pregnant. So they have a predilection for the placenta. Why? Guys, do you know placenta contains something known as erythritol? It contains something known as erythritol, and erythritol has a stimulant effect on Brucella. It has a stimulant effect on Brucella. So they did this study and they saw that in animals, the Brucella was growing more in placenta because placenta provides erythritol, and the same can be seen in humans also. So now you know what are the features. Now if I say head to toe, can there be meningitis? Can there be everything of the heart, that is peri-myo-endo, all types of carditis? Can there be all the organ involvements like hepatosplenomegaly? We know. Can all the genitals get affected? Males may epididymitis, orchitis, prostatitis. Females may of course fallopian tubes, so salpingitis. Arthritis of all the joints. Can you see the joints? They have labeled every joint over here. They've labeled the ankle joint also, the knee joint also, the sacroiliac and hip joint also. So arthritis of all these leg wala joints are there. And of course, there is involvement of the thoracic and the lumbar vertebra. There is osteomyelitis. So this is a multi-system disorder. These animals are going to make it quite deadly for us. So now you know that this is a disease in the animals and in the humans. So ma'am, you will have to tell me tests which you will do for humans and tests that you will do for animals. Of course, you're interested in humans first. So what is the media that you're going to use? I'm going to use a, so dekho, animals may be here, humans may be here. So I will use a media which is solid also, liquid also. Dono I will take together. So please remember, Castaneda media is a kind of a media. If I draw that culture bottle, it has a liquidy part here, and this liquidy part which you have usually is the trypticase soy broth. This liquidy part is the trypticase soy broth, and then they have a solid agar over here, right? They have a solid agar plate over here. So whatever organism or sample you will get now from the patient, you will put it over here. In the liquid part, you will put the sample. After that, for example, if this was your tube, right? If this was your tube, you are just gonna invert the tube like this. This culture bottle, you're gonna invert it so that all this liquid comes in contact with this solid, and finally this is where all the growth will be seen. You've understood how you do the growth? You put all the sample in this liquid, properly mix it, and then tilt this bottle so that all this liquid comes in contact with this, and the organisms will grow finally on this agar. So can I say this is biphasic? Biphasic means it's gonna have solid as well as liquid properties, and that liquid is trypticase soy broth. We don't have so much of time to do all these bottles. Now we have automated Vitec. Remember a white color dabba machine that I showed you in General Micro? That is Vitec. And this organism, because it's to do with so many animals, na? Cow, animal, cow positive. Cow beats all the tests. Catalase, oxidase and urease. This is gonna be cow positive, cow for an animal. Sorted. How are you going to do that? This is a culture media. What is the serology diagnosis? There is something known as standard agglutination test. Until now, I'm only talking about things you do in human beings. I've not reached the animals. Now, guys, by now you must have analyzed, or you will do in a while, there are lots of agglutination tests that are coming. So firstly, there is something known as the standard agglutination test, cold agglutination test, microscopic agglutination test. What did I say? Cold agglutination test, standard agglutination test. I'm going to repeat this mnemonic in a lot of places, but abhi ke liye, microscopic agglutination test. And these are respectively seen in mycoplasma. Standard agglutination I am teaching you over here, that is Brucella. And I will teach you this in the next chapter, that is Leptospira. So how will I learn it? CAT. So cold agglutination test is written as CAT. Standard is written as SAT. And microscopic is written as MAT. Cold agglutination, standard agglutination, microscopic agglutination, CAT sat on a mat. Cat sat on a mat, and that I've written as my Billy. Cat is Billy, na? So whenever in the exam you get cat sat on a mat, you will write my Billy. That will tell you cold agglutination for mycoplasma, standard agglutination for Brucella, and microscopic for Leptospira. The same mnemonic we had done exactly 48 hours before the NEET PG exam, and exactly after 48 hours it came in the paper. Everyone was super happy. That time microscopic agglutination test for Leptospira was asked. So cat sat on a mat, my Billy. So here I'm doing standard agglutination test. Standard agglutination test means I'm doing it for Brucella. So now let's do the details. What is standard agglutination test? Agglutination means you're going to take an antigen and an antibody. From the patient, you will get antibodies. From the patient, you will get antibody, and you will add an antigen in your lab. Of course, you will get agglutination. You don't have to learn the temperatures. Antibody from the patient, antigen in your lab. You're going to get a titer of more than 1:160. You say this is an agglutination positive. But that is positive for all antibodies. If you don't want to measure IgM, you only want to measure IgG, what will you do? You will treat it with 2-ME, mercaptoethanol. And if you treat it with 2-ME, the IgM is gonna destroy. The IgM will exit. So how I have learnt it is, when you treat it with 2-ME, that is mercaptoethanol, तो M for IgM, IgM का story end हो जाएगा, IgM का story exit हो जाएगा, or you can learn end हो जाएगा, right? So IgM will be destroyed. That is standard agglutination test that you do in humans. What is the test that you do in animals? And you can see that this is a milk, animal milk, white color milk, and I can see some of the rings, purple color rings. So what is that? That is the milk ring test. You can also do a Bengal card test and a whey agglutination test. These are all animal testings that are done. But you get a question on the milk ring test. So what do you see? You want to find out, does the animal have antibody? You want to find out the Brucella antibody in the animal milk. So in his milk, in the animal milk, you will take the milk. You are suspecting that should have antibodies. You will have to add an antigen. You are doing the same antigen-antibody agglutination. If antibodies are present, you will see an agglutination, and that is seen as a purple color ring. That is why what are you seeing? You are using the milk sample and you're trying to see the ring over here. That is why this is known as the milk ring test. So here you saw the ring, here you saw the ring. Matlab these two animals have antibodies, others do not. So that is the milk ring test. You can also do Bengal card and whey agglutination test if you want to. No. What is the treatment? Now, the treatment in adults is said to be doxycycline and streptomycin IM. However, there is an alternative protocol. So, we have said that doxycycline for 45 days and streptomycin is going to be for 14 days IM. However, there is almost a 6 week hota hai, right? But WHO has also said that there is an alternative in which you are going to use doxycycline with rifampicin for 6 weeks. That is something which WHO has told you, doxycycline with rifampicin for 6 weeks. And they have said that by chance there is a person suffering from neurobrucellosis. That is another thing put up by WHO. You will use the same doxycycline and the same rifampicin and also add it with ceftriaxone. also add up ceftriaxone in that case. So see, in most of the books you will find doxycycline and streptomycin, but it is DR, that is doxycycline and rifampicin by WHO, and additionally ceftriaxone if there is neurobrucellosis mentioned. And yes, that helps us finish HBB. We are ready for a few questions, I suppose. Quickly tell me, which of the following is identified on a milk ring test? How easy as a question. Milk ring for animal milk matlab brucellosis. What is the color? You get a purple color ring, purple blue color ring on the top. Next, in brucellosis, 2-ME agglutination is used for. You will say, ma'am, 2-ME में mercaptoethanol, IgM का तो end हो जाएगा. So what you will be left with will be IgG. So that was a very quick question that you had. Can you answer this for me? So tell me, all of the following are true about Bordetrll pertussis except. Okay, the most common cause is Bordetrll pertussis only. Fine. It may occur in children and in adults. Third, bacterial culture from nasopharyngeal swab is the definitive diagnosis. And fourth, presence of antibodies in the serum is diagnostic of the disease. So see, can it cause pertussis? Of course, that is the name. Can it occur in children and in young adults? Of course, yes. Bacterial culture from the nasopharyngeal swab is the most definitive. Is presence diagnostic? Antibodies is what is the diagnostic modality? No, I told you the Bordet Gengu medium. That was the most common. So which of the following is not very true or convincing is going to be the fourth option. Yes, with that we wrap up. Hemophilous, Bordetrll, Brucella done, HBB over. What do we jump on to next? We are now going to go on to the MRCS organisms, means the gram-poor organisms, the organisms that do not stain well. MRCS, so all your rickettsia, chlamydia, spirochetes, all of those are coming up your way.